Thank you very much, Susan. Good afternoon, everyone. So I must begin with a disclosure. I am a specialist in developmental and behavioral pediatrics. I am frequently called upon by families to diagnose and treat a wide array of childhood conditions: autism, attention deficit hyperactivity disorder, anxiety, depression. But what if our goals for child health services did not merely include diagnosis and treatment of a wide array of childhood diseases and disorders? What if our goals also included the promotion of children's healthy, optimal development? I submit to you that this would have profound implications for the way in which we deliver our services, build our programs, and evolve our systems. And why am I so confident in this premise? I'm confident because of our experience with Help Me Grow. Help Me Grow is an initiative that promotes children's optimal healthy development that began in Hartford in 1997, was disseminated across Connecticut in 2002, and currently, as we speak, is being replicated in 20 states around the country, the District of Columbia, and the Commonwealth of Puerto Rico. Help Me Grow focuses on the early detection of young children at risk for developmental and behavioral problems and the linkage of these children and their families to community-based programs and services. So I want to share with you the story of Help Me Grow. And context is important here. And in fact, our early thoughts about Help Me Grow evolved in the 1990s, the so-called decade of the brain, in which the explosion in our knowledge and information about early brain development and early child development was widely disseminated in the popular media and in professional publications. So it was within this context of the so-called decade of the brain that we engaged in a series of remarkable conversations. We engaged my colleagues in child health. We engaged early care and educational professionals. We engaged family support providers. We engaged leaders of community-based organizations. We engaged our public officials. And most importantly, we engaged parents and families. And through these conversations, we came remarkably quickly to a series of common assumptions. Number one, we assumed that in Hartford, children who were at risk for poor developmental and behavioral outcomes were escaping early detection. Unfortunately, we were not out on a limb with this assumption, as any visit to a Hartford kindergarten, first, or second grade classroom would attest. Secondly, we assumed that even in relatively resource-poor Hartford, there existed a wide array of programs and services: Head Start, family resource centers, parent support groups, that were available to address children's developmental needs and support families in promoting their children's optimal healthy development. And third, we assumed that Hartford, its children and families, would benefit from a comprehensive, coordinated, region-wide approach that focused on the early detection of young children at risk for developmental and behavioral problems, and the linkage of these children and their families to community-based programs and services. So armed with these assumptions, and a grant from the Hartford Foundation for Public Giving, we undertook a pilot project in Hartford in 1997 that ultimately evolved into Help Me Grow. Help Me Grow focuses on the early detection of vulnerable young children who are at risk for developmental and behavioral problems through the process of developmental surveillance and screening. And it links these children and their families to community-based programs and services, developmentally enhancing programs and services through a single central portal of entry, a telephone information and referral line, child development info line, 1-800-505-7000. Operators are standing by and ready to take your call. The success of Help Me Grow in Hartford from 1997 to 2002 encouraged us to advocate for statewide dissemination of Help Me Grow. And in fact, in 2002, Help Me Grow became a program of the Children's Trust Fund, now a unit within our Department of Social Services. This advocacy in support of statewide dissemination yielded extraordinary lessons, and I'm just going to share 3 with you. The first is the importance of the language that we use. In Connecticut, we are fortunate to have a wide range of very effective developmental programs. Our Part C of the Individuals with Disability Education Act Early Intervention Program, Birth to 3, our Part B of IDEA Preschool Special Education, our Title V Children with Special Health Care Needs programs are excellent, but only accessible to those children who meet the relatively restrictive eligibility criteria for these programs. In Connecticut, the land of steady habits, we knew that advocacy in support of expanding eligibility criteria was dead at the legislative doorstep. However, when we spoke with legislators about enhancing access to community-based programs and services that already exist, that were typically of no cost to the state, a managed care plan, or a family, there was receptivity and encouragement. Expansion of eligibility criteria dead at the legislative doorstep. Enhancement of access to community-based programs and services, well received. The importance of the language we use. A second lesson, the value of so-called strategic reframing. We viewed Help Me Grow as a developmental program. It was focused on identifying young children at risk for poor developmental outcomes and linking these children and their families to developmentally enhancing community-based programs and services. And in fact, developmental concerns were very, very common reasons for children and families to access Child Development Info Line and Help Me Grow. But they were the second and third most common reasons. The first most common reason were parents' concerns with their children's behavior. That is, behavioral concerns that had not yet escalated into emotional disorders and psychiatric diagnoses. So in 2002, at the time of our advocacy, then Governor John Rowland was championing an initiative called Connecticut Community Kid Care. And the focus in Kid Care was to expand community resources to address the needs of children with serious emotional disturbance. We went to Governor Rowland, and just as importantly, we went to his Chief Budget Officer, Mark Ryan, and said, we applaud Connecticut Community Kid Care, we support Connecticut Community Kid Care, but you need a prevention piece. And we have that prevention piece for you. And in fact, support for Help Me Grow was incorporated within the governor's budget, then supported by the legislature, and became part of the 2002 budget and has been re-supported in every biennial budget since 2002. The third lesson that we learned was the importance of data collection. We had critics. We had critics who said we would do more harm than good, because while they believed we would be successful at identifying young children at risk, they did not believe that the resources existed to create a successful linkage. We said, we think you're wrong, but just in case you're not, we will collect data. We will collect data on the gaps, we will collect data on the capacity issues, and we will use that data to inform our advocacy. And in fact, the critics were comforted by that. And indeed, as I have said, Help Me Grow has been a program in the state of Connecticut since 2002. So in 2007, I got a phone call. I got a phone call from a pediatric neurologist, Dr. Joseph Donnelly, in Orange County, California, whom I knew from his previous time spent at Bay State Medical Center in Springfield. And Dr. Donnelly was aware of our work in Connecticut with Help Me Grow and asked the question, can you provide technical assistance in enabling us to replicate Help Me Grow in Orange County? And I said, frankly, I don't know, but we're pleased to try. And in fact, Help Me Grow Orange County has been spectacularly successful. That imbued us with the confidence to go to the Commonwealth Fund in New York City in 2008 and receive a grant to support the replication of Help Me Grow in 5 states. In 2010, we received a $2.4 million grant from the W.K. Kellogg Foundation in Battle Creek to establish the Help Me Grow National Center at Connecticut Children's Medical Center to continue working in those 5 states and to bring Help Me Grow to an additional 10 states by the end of a 3-year grant period, which actually ends this month. And as I've mentioned to you, we are in 20 states, as well as DC and Puerto Rico. We've exceeded expectations. So why has this happened? Why the receptivity to Help Me Grow? Well, I would submit to you that there are at least 3 reasons. Number 1, Help Me Grow does what it sets out to do. That is, it successfully links children and families to programs and services. Evaluation consistently demonstrates that 85% of children and families are successfully linked to a developmentally enhancing program and service. Number 2, Help Me Grow does promote children's optimal healthy development. We have the research that shows that linkage to these community-based programs and services strengthens those protective factors that correlate with the best developmental outcomes for children. Parents' resiliency, parents' access to community resources, concrete support to families in times of need, parents' skills in parenting, parents' knowledge of child development, and children's social and emotional competence. Help Me Grow promotes children's optimal healthy development. And third, the spread of Help Me Grow has undoubtedly been facilitated by the fact that it has cost benefits. We know of the fiscal exigencies at the federal and state levels. When Help Me Grow is in place, child health providers are more likely to link children and families to community-based programs and services rather than refer on for the next in a series of medical and laboratory evaluations that typically add very, very little support and value. Cost effectiveness. I would say to you, ultimately, the reason for this dramatic spread of Help Me Grow is the testimonials on the part of parents and providers. And I invite you to go to helpmegrownational.org, our website, and to watch the video of the very first call to the Washington State Help Me Grow program and listen to the parent and the care provider speak. I will tell you, having been involved with Help Me Grow since its humble origins on the streets of Hartford, to see the impact of this initiative now on a family across the country in Snohomish County, Washington, is overwhelming. So, where do we go from here? We will not be satisfied until every state has the opportunity to replicate Help Me Grow. And in fact, requests and new affiliates are coming in at least monthly, if not weekly. In addition, we must always be mindful of new information to enable us to be even more successful in promoting children's optimal healthy development. We know so much about the impact of social determinants on children's developmental outcomes. We understand so much better the influence of early experiences and how they can either facilitate or hinder children's optimal development. We know so much about the pernicious impact of toxic stressors on young children's healthy development. These demand our effective community engagement to strengthen those protective factors and overcome these toxic stressors. I have no doubt that we have the skills and the knowledge to do this work. I also am very confident that we are evolving the structures to do this work. So at Connecticut Children's Medical Center, we now have an Office for Community Child Health that supports the promotion of children's optimal healthy development. What I don't know is whether or not we have the public and the political will to do this work. Only you know the answer to that question, and I hope it's in the affirmative. Thank you very much.